What if I told you that one small habit you do every single night could quietly weaken your heart after the age of 60, and that fixing it doesn't require a new medication, a strict diet, or expensive supplements? I know that sounds too simple. You're probably thinking, I've heard this before, doctor. If it were that easy, my cardiologist would have told me. And honestly, I understand that skepticism. Most of my patients felt exactly the same way. They had already tried supplements that promised miracles, diets that were exhausting to maintain, and advice that sounded good but never seemed to move the numbers in a meaningful way. My name is Dr. Elena Morris, and I've been treating men and women in their 60s and 70s for over 20 years. I've spent decades listening to patients who were doing almost everything right, taking their medications faithfully, walking every day, watching their salt, checking their blood pressure, yet still struggling with fatigue, rising numbers, or that unsettling feeling that their heart just wasn't as strong as it used to be. And what I've seen again and again is that correcting this one overlooked night habit can lead to measurable improvements, often up to a 30 to 40% improvement in morning blood pressure stability, resting heart rate consistency, and overall cardiovascular resilience within weeks. These are people who are tired of worrying, tired of spending money on things that don't work, tired of being vigilant every single day and still feeling like they're falling behind. If that sounds like you, please know this: you are not failing. Your body is changing with age, and it needs different support now than it did at 40 or 50. Before we go any further, I want to ask you something simple. Where are you watching from today? Please take a moment and comment your country or city below. I read those comments, and it helps me understand the community I'm speaking to. And let me be very clear about something right away. This is not about replacing your medications. This is about safely supporting what you and your doctor are already doing. Nothing I share today should ever be a reason to stop prescribed treatment. Now let's talk about what's actually happening inside your body after 60. As we age, several physiological changes directly affect the heart. First, total body water decreases. By your 60s and 70s, you can have 10-15% less available fluid than you did in midlife, even if you drink what feels like enough. Second, the kidneys become less efficient at conserving water overnight, which means you lose more fluid while you sleep. Third, the baroreceptors, the pressure sensors that help regulate blood pressure, become slower to respond. And fourth, the heart muscle itself becomes slightly stiffer, making it more sensitive to changes in blood volume. Here's what most people, including many healthcare providers, completely miss. When you go to bed even mildly dehydrated, your heart works harder all night long. That strain doesn't always cause dramatic symptoms right away, but over time it creates measurable negative effects: higher morning blood pressure spikes, increased resting heart rate, and reduced cardiac efficiency. Mild symptoms like morning dizziness, palpitations, or fatigue aren't just aging, they're signals. Let me tell you about Margaret. Margaret is 68 years old. She sat in my office one afternoon and said, "Dr. Morris, I don't understand what I'm doing wrong. I take my medication, I eat well, I walk every day, and my numbers still jump around." She tracked everything. Her husband was worried because she seemed exhausted by noon every day. When I asked her to walk me through her evening routine, she casually mentioned that she stopped drinking fluids after 6 p.m. because she didn't want to wake up at night. That one sentence changed everything. I asked her a simple question: "How do you feel when you first stand up in the morning?" She paused. That was her aha moment. She realized she often felt lightheaded, but she had normalized it. The hidden issue wasn't what she was doing during the day. It was the dehydration window she created every night. We made a few simple strategic changes, not drastic ones. We adjusted timing, not volume. She drank 8 ounces of room temperature water about 60-90 minutes before bed, with a small pinch, about 1/16 teaspoon, of mineral salt to improve absorption. She avoided ice-cold water, which can stimulate stress responses, and kept the temperature neutral. 2 weeks later, she called my office. Her voice sounded different, calmer, more energetic. After 1 month, her morning blood pressure readings had stabilized by nearly 35%, and her resting heart rate dropped by 6 beats per minute. She laughed and said, "I honestly thought you were a little crazy, doctor, but it worked." Before I teach you the method, let me explain the 3 most common mistakes I see every single week. Mistake number 1 is cutting off fluids too early. It's like sending your heart into a long overnight fast without the reserves it needs. Mistake number 2 is chugging large amounts right before bed, like dumping water onto dry soil. It just runs through without being absorbed. And mistake number 3 is ignoring temperature and mineral balance, which affects how efficiently fluid actually enters your bloodstream. Now let me introduce what I call the HEART method. H stands for hydrate strategically, E stands for electrolyte balance, A stands for absorption timing, R stands for rest phase support, T stands for track and adjust. Phase 1 happens 90 minutes before bed. Drink 6 to 8 ounces of room temperature water. Phase 2 happens 30 minutes later. Another 4 to 6 ounces with a tiny pinch of mineral salt if approved by your doctor. Phase 3 is simply allowing your body to rest without further intake. This supports blood volume, reduces overnight cardiac strain, and stabilizes morning numbers. Let me tell you about Robert, 72. His biggest frustration was fatigue and morning pressure spikes. He started with just phase 1. 3 weeks later, his labs improved and his cardiologist reduced 1 medication dose. He told me, "I feel genuinely different, like my body finally caught up." Practically speaking, patients ask me, "How much? How often?" The rule is simple. Never exceed what feels comfortable and spread it out. Keep a bottle by your evening chair. Set a gentle reminder. Week 1, expect better mornings. Week 2, steadier energy. Weeks 3 to 4, measurable improvements. Long term, patients tell me, "Doctor, I just feel better overall." Let me be absolutely clear about something critical. This is not a replacement for medical care. Do not stop medications. Continue following your doctor's plan. If you have kidney disease, heart failure, or fluid restrictions, you must consult your physician first. Finally, I want to share Helen's story. Helen is 75 and had struggled for nearly 20 years. She was fearful, discouraged, and convinced nothing would help. With the HEART method, she cried in my office 6 weeks later and said, "I wish someone had told me this years ago." I want to challenge you personally. Try this method for 14 days. Follow the steps. Track how you feel. Comment your progress below. If you made it to the end, type Heart Strong. Share this with someone you love. Subscribe and ring the bell. Small strategic changes done consistently create genuinely measurable results over time. This is Dr. Elena Morris, and I'll see you in the next video.